Okay, Mom, I'm going to assess the baby now at this time. We're going to start with suction. And when you do that, you want to compress the bulb and then put it into the baby's mouth. Let it go, take it out, and squeeze all the contents that you got out on something so you can look at what the secretions look like. And you're going to do that in both pockets of the mouth and then both sides of the nose. Now I'm just going to do the head to toe. Starting with the head, the baby has a little bit of a cone head. That's okay. It'll go down, and that is normal. The baby's eyes, the sclera is white, and the conjunctivi is pink and moist. The baby face seems to be symmetrical. The ears, the top of the ear is aligned. Is aligned with the eyes. And the pinna is not coiled, which means this is a full-term baby. The ears look full. There's no drainage, redness, bruising coming out of those, none coming out of the eyes, mouth, or nose. I would put on my gloves and put my finger in the baby's mouth, feel around. I can't feel anything that is disformed in the mouth right now. No cleft palate notice. The baby's tongue is symmetrical, and it can stick out over the bottom lip, which is good for breastfeeding. And I stroke the baby's cheek. The baby moves over to the side. That's the rooting reflex, and the sucking when I put the finger in the mouth and the baby does suck on my finger. Okay, that is everything with the baby's head. The fontanelle is soft and flat. No bulging or anything to indicate increased pressure. Okay, the baby's overall color is pink, normal for ethnicity. No bruising, scarring, abnormalities. It is warm, dry, and everything looks to be intact. The skin turgor is non-tinting, and the cap refill is less than 4 in the hands and less than 3, I'm sorry, in the hands and in the toes. Okay, moving down to the baby's chest. Everything looks aligned. The baby is breathing what appears to be normal. No retracting, no nasal flaring, no grunting as the baby breathes. Now I'm going to do vitals. I'm going to take temperature axillary up under the baby's arm here. Normal temperature 36.5 to 37.5 Celsius. That is fine. Listen to the heart rate for a full minute at the mitral valve apical that is under the breast line, and listen for a full minute. Normal would be 110 to 170 beats per minute. Temperature, pulse, and respirations. I will listen to the respirations for a full minute, and normal would be 30 to 60 beats per minute. Next, I'm gonna check pulses. I'll do brachial. They're equal, +2 bilateral. Then I'll do the femoral. They're equal, +2 bilateral, and then I'll do the pedal, and they're equal, +2 bilateral. Now I'm going to note some spots before I listen. We have the aortic valve here, then we have the pulmonic valve Herb's point, tricuspid, and then in the middle here is the mitral valve. Like I said, I will listen for a full minute for the apical pulse in this spot. Now I'm gonna listen to my lung sounds. Okay, lung sounds are clear, equal, bilaterally. Okay, that's fine. Now I'm going to look at the stomach. The baby's stomach is symmetrical, no bruising, abrasions, or abnormalities noted on the stomach. I'm going to listen to the bowel sounds. Bowel sounds equal and heard in all four. Not equal. Bowel sounds present and equal and heard in all four quadrants. Okay, baby looks fine there. Now I'm gonna turn the baby over, and I'm gonna listen to bowel sound, listen to the lung sounds on the back. I'm gonna stay close to the spine because of the scapula is there. Okay, same bowel sounds, equal and clear bilaterally. The spine looks looks midline, no deviations there. There's no bruising or anything noted on the back. There's no dimple on the sacrum to indicate Erb's palsy. Everything looks fine on the baby's back. Now I'm gonna go ahead and look at the baby's genitals. I'll take off the diaper. This is a girl. Her labia majora is the only thing visible right now, which is normal for a full-term baby. It's a little swollen, and that's okay. If this was a boy, I would look at the circumcision and make sure it was clean, dry, and intact. The urine here is clear and yellow. There is a little bit of meconium here, which means this is the first stool that the baby has, and we'll just change that out. Okay, Mom, has the baby been breastfeeding pretty well for you?
Yes.
Okay, and how many times have you been able to breastfeed?
3.
And for about how long?
Let's say about 2 to 5 minutes each time.
Okay, so just keep that up. Just keep, whenever the baby seems like they're hungry, just try to get her on. Okay, that's cool. I didn't notice any birthmarks on the baby's skin to be documented. So now I'm gonna check some reflexes. I'm gonna put my baby's put my hand in the baby's hand, and the baby will grasp my hand. That is the plantar reflex. I'm gonna put the baby's arms up and test the motor reflex to see if the baby startles by taking my hand out and letting go. And the baby startles. That is the moral reflex. Now I'm gonna look at the baby's feet. I'm going to take my finger on the outside of the baby's foot and put it up, and the baby feet toes spread like this. That is the Babinski reflex. And then I'm gonna put my fingers in both the baby's toes, and the baby's toes curl around my finger, and that is the plantar reflex. Okay, I think that's all I have, Mom. Do you have any questions or anything?
No, ma'am.
Okay, well, I am done with baby. I will wrap baby up. Okay, baby is all bundled up and you can have baby.
Thank you.